I'm Robert Burns, a professor here in the Department of Healthcare Management at the Wharton School, here to talk about a paper that Mark Pauly and I just published in Milbank Quarterly last month. It's called Big Meds Spread. It's about the spread of these big med hospital combinations across the country. In particular, we're looking at one set of those combinations that are referred to by economists and policymakers as cross-market mergers. Mergers between hospitals that are in totally disparate parts of the country. The hospital executives of the systems that are engaging in these mergers posit one set of benefits and advantages to the public of doing these things. Mark and I are naturally skeptical of those, and so what we've done in this paper is basically dissect all the rationales that are posited for these things and debunk them. And what we suggested, hospital boards ought to take a little bit more activist role in supervising these kinds of mergers because it may not be benefiting their communities. Policy-wise, what we suggest is that both federal and state regulators ought to continue to be skeptical of the mergers that are taking place in the hospital community and ought to be looking into these things a little bit more carefully. What we're seeing is that they may not be raising prices, but they're not necessarily doing anything to benefit the public's welfare.